Welcome back. This is Kaan at the ACL Academy, and today I'm dropping a video on a assessment, psychological readiness assessment that we like to use for our athletes before they return to sport. So we use this assessment along with our global rating score, which I did a video on a few weeks back, a month back, and basically a global rating score is asking an athlete to rate their knee 0 to 100%. It really kind of gives us an inside look on what they feel in their head, what the level of the knee is at. This is a psychological readiness assessment that we like to use as we're getting further in the rehab process, as the athletes are slowly thinking about getting back to their sport. Before I get further into this, guys, if you've been following along at the ACL Academy, if you found value out of these videos, please subscribe to the channel. Please like the video. Got questions, comments, drop them below. And of course, more importantly, share with a fellow ACLer that can benefit from these education and tips. So this is known as the ACL RSI, Anterior Cruciate Ligament Return to Sport After Injury Calculator. This was developed in 2008 by Kate Webster, and basically it's to measure the athlete's emotion, confidence, risk appraisal when returning to your sport. So when you take this survey, when we give this survey to our athletes, we tell them, think about your specific sport. And that could be anything, right? Soccer, basketball, mountain climbing, skiing, snowboarding, whatever it may be. When you're taking this survey, we want you to think about partaking in that particular sport, because this gives us an inside look on how to do it, how to assess it and score it. And we would start this probably survey anywhere from 5 to 6 months into this rehab process. And I would do this survey monthly as well, because as you're progressing, physically you're getting stronger, better, faster. You're also gaining more confidence. And as you're getting further along the process, we're going to start incorporating your sport-specific activities. It's another way to really get a good gauge and idea on that score. So this is free. This is accessible on Google, and they score it right for you. So let me just show you how I get to it. So it'll be easy to follow. Let's say you're just on Google. All you're going to type in is ACL RSI, and it's usually the first or second. Okay, so Ortho Toolkit is free online ACL return to sport. You're going to click that. This survey has 12 questions, and I'll run through these. Very straightforward for you, and then we'll talk about the scoring and what we're looking for. So again, as I said, you're going to think about your specific sport when answering them. And basically it's a sliding scale here. Are you confident that you can perform at your previous level of sports participation? So you're going to score it 0 to 100. Do you think you are likely to re-injure your knee by participating in your sport? So you'll score that. Are you nervous about playing your sport? Are you confident that your knee will not give way by playing your sport? Are you confident that you could play your sport without concern for your knee? Do you find it frustrating to have to consider your knee with respect to your sport? So again, just sliding the scale 0 to 100, going through these. Number 7, are you fearful of re-injuring your knee by playing your sport? So you'll see some of the questions are similar and they ask them in different ways. Just it really gets you thinking, and it gives us more of a specific score. Are you confident about your knee holding up under pressure? Are you afraid of accidentally injuring your knee by playing your sport? Do thoughts of having to go through surgery or rehabilitation prevent you from playing your sport? Are you confident about your ability to perform well of your sport? Do you feel relaxed about playing your sport? So you're going to go through these. If you have more than one sport, what I would say to you is the sport that maybe scares you the most or makes you nervous or really more unsure of, that's how I would fill this survey out. And after you go through all these, they will give you a score here. So here's my score, 70.5%. And then they kind of break it down into emotions, confidence, performance, risk appraisal. So you'll see my emotions are 69%, confidence, performance at 68%, risk appraisal is 82%. So it gives us 3 scores, but the major breakdown is here. And really the way that we've looked at this, or it's been studied, and we found that we want athletes to score at least 78 before they get back and return to their sport. So when you first take this, maybe at month 5, you may not even partake or play in your sport at all. your score is not going to be too high, right? As you start reintegrating yourself to a sport, let's say soccer, for example, you may start doing some individual drills first, then maybe some passing drills, and getting into some one-on-one non-contact drills. After you're doing this stuff little by little, right, you're going to gain confidence in your movements, confidence with the ball, confidence with opposition, right, an opponent with you. And then when you get into contact, you're going to get even more confidently, right? So you're going to take this test once a month, you know, right when you probably start, like probably after you start jogging, as you're getting into plyometrics, agilities, things like that, as you get into more dynamic with your rehab process, that's probably when I would start taking this survey. Maybe, like I said, month 5, 6, 7, and then every month thereafter, you want to track it. In addition, like how we talk about, passing tests, we want our strength scores to be good. We want our functional testing, our jump testing, hop testing, things like that to be good, and psychological readiness, right? So this is one survey we 100% use. This is known as the ACL RSI. And the other one component that I'd like to use also, as I touched on before, is the global rating score. And that simple question you want to ask yourself: how would you rate your knee from 0 to 100%? And that also will give you a score. And just gives you a little insight in the confidence of yourself, confidence in your knee, and confidence as you return back to sport. This is so important because the ACL process is a long one, and it's going to take a little bit of a mental toll. We want to make sure that not only you're physically ready, but also mentally, emotionally strong and confident in yourself and your abilities before you even think about getting back to a high volume sport, especially a sport that requires cutting, pivoting, things like that. We do not want you going out there nervous. And a survey like this really gives us some great insight on what's going on in your head, and maybe some areas that we need to work on or talk about. And it may not even be in physical therapy. It may be something that may require a sports psychologist, social worker, somebody to talk through or work through to help you overcome some of these emotions that you may be having. So if that was helpful, guys, check it out. As I said, just go to Google, ACL RSI, orthotoolkit.com makes it. Takes about 5 minutes to do, if that, and it gives you a score. And I think it'll give you some great feedback and value and insight. If you have any questions, drop them below. As you found some value out of these videos, please subscribe to our channel. Please like, comment, question below. And of course, as I said before, share with a fellow ACL that can benefit from these videos. We drop a video here every Monday. I'll see you guys next time. This is Dr. Kaan signing out.